Good afternoon, and thank you for joining us for our weekly update. Today I am joined by Dr. Lawrence Lowe, our Medical Officer of Health here in Peel Region, Tim Beckett, our Fire Chief and the Director of Emergency Management, and Shannon Van Rassel, who is the Senior Vice President at Trillium Healthcare Partners Foundation. We continue to make significant progress here in Mississauga in terms of our case count declines, with an average of 6 new daily cases reported here in Mississauga over the past week and just under 100 active cases. Yesterday, we saw only 1 new case in Mississauga, and we were pretty excited about that. And right before I walked in today to today's press conference, my staff gave me even better news. Mississauga today is reporting zero new cases. You heard me right. No new cases of COVID today in Mississauga, and boy, am I happy. A first since this pandemic broke. And while I'd love to see the numbers stay at 0, we also know that this is not realistic. This pandemic is far from over. We need to continue to take it seriously, and we cannot rest on our success. We've been in stage 2 for 3 weeks now, and we continue to see a sustaining number of declining cases across all 3 municipalities in the region. We have seen businesses starting to rebound, with many bars and restaurants taking advantage of the temporary patio expansion program. We've seen residents out and about catching up with family and friends and enjoying the best that summer has to offer. Life is starting to get back to normal. It's so nice to see that. But we still have a lot of work to do as a region to drive our numbers down, and I'm confident that we are near ready and prepared to enter stage 3 very shortly. I want to thank the Premier for continuing to take a cautious, regional approach that recognizes that some areas of the province are a bit further ahead than others, and of course, we need to act accordingly. The province will reassess our situation on Monday, and there is a possibility that we can move to stage 3 here in Mississauga on Friday, July 24th, or possibly earlier. Stage 3 is a very big deal, perhaps even more so than stage 2. It will see the reopening of virtually all businesses and public spaces and public gatherings increase significantly. This is not something we should take lightly, nor should we rush it. It's not worth it. Our goal throughout this pandemic has been to move forward and never once look back. There will be a resurgence of COVID-19 this fall, and it's up to us to develop good habits now to keep our numbers down and to reduce the severity of the potential second wave in the fall. We're all seeing what is happening south of the border, and frankly, it's terrifying. I'm very pleased that the Prime Minister isn't budging on reopening our land border to non-essential travel. We cannot get complacent. We're still in the pandemic, and many parts of the United States, they are very much still fighting the first wave and moving back into lockdown. The virus moves quickly, and as we enter stage 3, we need to be particularly careful, especially in the bars and restaurants and the clubs, to ensure the safety of everyone. Our businesses and our people can't afford another lockdown once again. We know that when we further reopen the economy, we inevitably risk further transmission, which means that any further reopening must be met with enhanced health and safety measures. We want more businesses to open and stay open, which is one of the reasons why Mississauga moved forward with a bylaw last week to make face coverings mandatory in indoor public spaces. The requirement went into effect on Friday, July the 10th, and I must say, for the most part, we have seen great compliance, particularly on our My Way buses, which is incredible. I was out at Square One Shopping Mall on the first day to greet shoppers, and virtually everyone who arrived in the mall came in prepared with their own mask or face covering or bandana. I want to thank Square One and the thousands of businesses right across our city who are going the extra mile to educate their customers, provide hand sanitizers, and in some cases, free masks for those who may have forgotten theirs. Businesses can and should be denying entry to customers who are not wearing a face covering and do not meet the exemptions. We have had several supports in place to help businesses comply with the new bylaw, including a toolkit and signage. We also have a full complement of just over 100 bylaw officers out and about across our city, engaging with our residents, with our businesses, and with transit users on the rules. And while our approach continues to be one of education, we have started issuing fines for non-compliance this week, with fines for individuals set at $150 and $300 for businesses. Since the bylaw went into effect, we have received roughly 100 calls to 311, which has been a mix of enforcement and general inquiries about the new mandatory face coverings rule. We will continue to focus on education and rely on our residents to do the right thing. When you leave home, don't forget your keys, your wallet, and your mask or your face covering. Remember, my masks protects you from me, and your mask protects me from you. Let's continue to be kind and considerate and think of others as we fight this as a team, Mississauga. Yesterday, I continued to hammer home another important issue at the province's Standing Committee on Finance and Economic Affairs. Emergency funding for cities helps us deal with the dire financial situations in our communities because of COVID-19. The financial impact of the pandemic on the City of Mississauga in 2020 is estimated to be $107 million. We have worked to offset these losses, including laying off 2,000 temporary staff and instituting a hiring freeze as a result of and also cutting all discretionary spending. These measures have helped us find $47 million in savings. We are doing our part. We are finding savings wherever and whenever possible. And as always, Mississauga continues to be a strong financial manager. But it's not enough, not even close. The bottom line is that we're staring down at unrecoverable losses in 2020 of over $60 million. Over the next 3 years, our non-recoverable losses are expected to balloon to $140 million. The federal and provincial governments have many more financial tools at their disposal to provide cities with relief, and we need them to do so now. It's time for a national strategies for all municipalities across this country. Cities need certainty. We need the ability to plan. We can either plan for a recovery, or we can plan for deep cuts to programs and services that will impact our residents. I want to thank the committee for listening, and I want to thank Premier Ford for continuing to advocate for cities with his provincial counterparts and for striking a deal with the federal government that works for cities. He has been working very hard. We need to keep working until a deal is reached that is satisfactory for everyone right across the country. Cities cannot wait any longer. And with that, I'd now like to turn it over to our Chief Medical Officer of Health, Dr. Lawrence Lowe, to provide us with a brief update of Peel Region's response to the COVID virus. Thank you. Just a second, Dr. Lowe, while I get.
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 2,837 cases of COVID-19 in Mississauga. Of these, 2,518 have recovered, 96 are active, and 223 residents have passed away. As the rest of Ontario moves forward into Stage 3 of reopening on Friday, we here in Peel look on in preparation as we continue our discussions with the province around their decision. Regionally, our 7-day moving average of new daily cases continues to decline as our hospital picture continues to improve. Tracing and testing capacity remain optimal, and in long-term care settings, most of our homes in the region are now out of outbreak. I'm hopeful that if these trends continue, we will enter stage 3 sooner rather than later. But let me be abundantly clear. None of this means that we have won. Stage 3 is the third period, and we have played COVID-19 to a 1-1 tie. Our opponent is tenacious. I know we are tired, but we must play at least another 20 minutes. And if a vaccine doesn't show up by the end of regulation time, then we go into overtime. Even if we get some good days like today in Mississauga, where our daily cases hit 0. Even if our hospitals clear out. One lapse, and we will be right back in the hole as COVID-19 continues to circulate in our community. Experiences elsewhere reminds us that gains can be wiped out in an instant. We must remember just what we have overcome together here in Peel and in Ontario. We did not enjoy the same geographic or other sociocultural advantages of other places, yet we still managed to succeed and flatten the curve. Our deep integration with the United States until mid-March was almost our undoing. Seeing the crisis south of the border reminds me that it was the challenges in that country with their testing strategy that led to propagated spread here initially, which ultimately drove much of our big seeding. Public health across Ontario had been contact tracing since our first case arrived in January, but I remember how a switch somehow flipped in March. Our reported cases shot up, and it was clear that many of them were returning from trips stateside. Consider that outside of the United States, there are precious few other cities connected to the New York City metropolitan area than we are here in the Greater Toronto Area. Celebration Square is better connected to Times Square than some mid-sized United States cities, and we all saw what happened in New York in March. And despite all that was against us, we, our community, has been the difference. Through March and April, you stayed home and closed your businesses, and then emerging into May, we learned about the core 4 behaviors to reduce risk in our interactions: distancing, hand washing, wearing a non-medical mask in close quarters, and staying home and getting tested if sick and exposed. Together with our hospital and healthcare partners, public health kept up our response. We've all kept you informed on the numbers and the science and brought a dire picture under control in our long-term care settings. Then, like our storied veterans in Ortona in World War II, our battle has been house to house, workplace to workplace, stamping out clusters and chains of transmission since. We have overcome so much to save lives, preserve our healthcare system, and position our community for a strong recovery. We must know and remember that those gains can be lost in an instant. And as we move forward, our victory lies in continued vigilance. Regardless of what opens, what stage we might be in, there is no secret about what we must all do to keep COVID-19 under control and our community open. Practice the core 4. Keep track of your circles and be careful in your interactions. Keep up the good work, be kind, and look out for each other. And remember that how this story ends is in all of our hands. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. This fight wouldn't be possible without Peel Public Health working lockstep with Trillium Health Partners. Our hospitals have been challenged in a big way over the course of this pandemic, from working at the drop of a hat to add additional hospital capacity, more intensive care beds, medical equipment, and PPE for our frontline healthcare heroes. They haven't stopped working to keep you safe over the past 4 months. They needed our help to meet this unprecedented demand, and our community did not disappoint. I've been happy to lend a hand a few times to help deliver meals or to donate PPE on behalf of our community, and I must say that the generosity that I've seen over the past few months has been truly incredible. Our residents and our businesses have been hard hit, but they've come together to find ways to give back and to end whatever they could give to make a difference. And with that, I'd like to invite Shannon Van Rassel, Senior Vice President at Trillium Health Partners Foundation, to provide us with an update on the hospital's efforts. Thank you, Shannon.
Oops. Thank you, Mayor Crombie. It's a huge honor for me to be here today on behalf of Trillium Health Partners Foundation and Trillium Health Partners to thank the community for its generosity in our fight against COVID-19. Our community has been hit harder than most, and in fact, Trillium Health Partners has treated one of the highest number of cases in the entire province. We could not have done it without you. When COVID-19 hit, we reached out to the community for support, and the response has been absolutely overwhelming. I'm so proud to share today that we have raised more than $5 million in cash and in-kind donations throughout this period from more than 10,000 donors. Some examples of what we've received: 900,000 items of personal protective equipment, or PPE, 131,000 thoughtful gifts, including snacks and personal care products. We had 21,700 meals for frontline staff workers, 21,000 gift cards. We had 620 notes and signs of encouragement from the community. 13 celebrities came forward to offer encouragement and support. For example, we received a Puma shoe donation from RJ Barrett, gift cards from the Toronto Maple Leafs, and a visit from former Blue Jay Dalton Pompey and his father with a PPE delivery. We also had 6 hospital drive-by salutes from various groups, including first responders, daycares, and Canada Post workers. I would also like to extend a special thank you to Mayor Crombie, who visited our hospital at least 10 times to deliver warm meals and PPE. So thank you, Bonnie. To everyone who opened their hearts, donated, or simply stayed home to flatten the curve, thank you. You've truly made a difference. As the pandemic goes on, the Foundation continues to ask for donations to support our frontline health workers, to maintain our capacity to care for COVID-19 patients, and to support families and patients. Please continue to give at trilliumgiving.ca and look out for your neighbors and community. We are so proud to be your hospital. Thank you.
Thank you, Shannon, and to the thousands of our healthcare heroes who work long hours, spend time away from their families, and put their health on the line to keep us safe. It's because of all of you that we are here today. Thank you, and now I am ready to take questions from the media.
Mayor Crombie, your first question comes from Caledon from Mississauga. Caledon, please go ahead.
Hi, Bonnie. Hi, Dr. Lowe.
Welcome.
With 0 new cases of COVID-19 in Mississauga today, is there a chance that the higher COVID-19 cases in Brampton can hold the entire region back from entering into stage 3? Or can we split up the region's reopening like they did in Windsor?
That's a very good question. I think the Premier is the only answer to that, but maybe Dr. Lowe can offer us his insight because he's at the council table with the other medical officers of health. Dr. Lowe?
Yeah, thanks, Khaled, for the question. We continue to monitor various indicators, which include, obviously, the case count, but certainly as well capacity to respond in the event of a surge or an acceleration of cases. That includes the testing, tracing, and healthcare capacity that is monitored by the provincial reopening framework. As I understand it, the province also takes a number of other considerations into their decision, including movement patterns, geographic continuity, like basically different regions that are next to each other, and also, at least for myself in making a recommendation, I take a look at how many of the cases we actually have connected to known chains of transmission and clusters. Overall, the way things are looking, quite even with continuing cases in Brampton that are on a slower decline than what we see in Mississauga, point to things being largely towards a stage 3 reopen sooner rather than later, particularly as our capacity remains optimal in testing, tracing, and in hospitals. But certainly the ultimate decision will be taken by the province, and we will be continuing our conversations with them. Thank you for the question.
I have a second question as well.
Certainly, Khaled.
Is the Peel region working with the school boards in Peel to help them come up with a safe plan for the kids and teachers to come back to school this September?
Yep, Dr. Lowe is going to respond to that as well. Thank you, Khaled.
Okay.
Thanks, Khaled, for the question. So just in respect of school reopening, we continue to work through the Council of Directors of Education and the Council of Medical Officers of Health to provide advice and insight into that, but ultimately the decision will be taken by the Ministry of Education in consultation with the Chief Medical Officer of Health for the province and the Ministry of Health as well. So I understand that those discussions are there. We have the opportunity to provide input as it pertains to our local situation, but it will ultimately be a provincial decision. Thanks for the question.
Next question.
Mayor Crombie, your next question comes from Noor Javid from the Toronto Star. Noor, please go ahead.
Welcome, Noor.
Hello, can you hear me?
Yes, we can.
Can
Thank
you
you.
hear me? Okay. Just really wanted to know, I know, across the GTA, there are different concerns that people have around getting into stage 3. Are there any specific concerns that might be kind of catered to the 905, to Mississauga in this case, or to the Peel region in general? Because I know, as we know, Peel had higher numbers as compared to some of the other parts of the GTA. So any kind of specific concerns that you guys are concerned about, we kind of go towards the reopening, or are they kind of just more general in terms of people wearing masks, that kind of thing?
Certainly, Noor, exactly. We just want to ensure that people continue to follow the guidelines, keep safe physical distancing, wear a face covering, can be anything, a mask, a scarf, a bandana, a neck gaiter, whatever you like, while you're in indoor public spaces, continue to use hand sanitizer, and just follow all the rules and guidelines. I think that the GTHA mayors expressed a concern that the bars and pubs reopening would foster more gathering of individuals, and hence we saw the rule come down that bars would be treated as any other restaurant would, as long as people are sitting at tables and dining. That was okay once following the guidelines for phase 3, and maybe I'll ask Dr. Lowe if he would like to add anything to that. But certainly the GTHA mayors, we have a conversation every Monday, and we express our mutual concerns and feed those up to the province and to our public health officials so that they can also reiterate them when the decisions are being made at the council table and being forwarded to the premier. So just want to ensure that everyone is following the rules and the guidelines, and you can see from our success in Mississauga today, I am so elated, and I know it will change tomorrow, but today is a good day and I'm celebrating today. 0 new cases. Dr. Lowe?
Yeah, thanks so much for the question, Nora. I think the reality is that this is why we are speaking to the core 4 behaviors. I think individuals need to take whatever steps they can to ensure that they're maintaining distancing, wearing a non-medical mask, staying home and getting tested if they are sick, and washing their hands frequently. But it is also really incumbent upon businesses, whether you have already reopened in stage 2 or are due to reopen in stage 3, to have a workplace safety plan, a plan to reopen safely with COVID-19 precautions in place, and additionally, to ensure that you are following the sector-specific guidance for whatever type of business you may be operating that are available on the Ministry of Labour's website. It is critically and vitally important that those precautions be in place to protect your staff, to protect your customers, and to allow everyone to practice the core 4 behaviors as we continue to unlock more of our community. Thank you for the question.
No, just one quick follow-up was, what were the numbers in Brampton today? And I think this question is for Mayor Crombie, is will your bylaw officials still be out ticketing? Like, what will they be looking for? I know, previously, because we were calling it about gatherings and stuff, is that still going to be, could people still call in around that, or
11?
like as we go into stage 3?
So the cases in Brampton today are 11, down from 36 yesterday. So I'm sure that's on the right trend line as well for Brampton. So we're very excited for that news. And the second part of your question was, sorry about that, Noor.
Oh, it's okay. It was around just ticketing and bylaw kind of
Oh,
enforcement.
bylaw.
Like
Yes, so the approach our
yeah.
bylaw officers, and with respect to our ambassador program that you see walking through our parks, the ambassador program in indoor spaces like the Square One Shopping Mall, we take the approach of education first. We always do, and just remind people that masks are now, face coverings rather, are now mandatory in indoor public places. And I find that people just quick to, oh yes, have my mask right here in my back pocket, just forgot myself, etc. Very, very few people are non-compliant. In fact, I don't believe we have laid any tickets for non-face covering wearings yet. Thank you. Dr. Lowe, do you want to add anything to that? No, that's fine. Okay.
Mayor Crombie, your next question comes from Steve Cornwell from the Mississauga News. Steve, please go ahead.
Hi, Mayor Crombie.
Welcome, Steve.
How are you? Just a question about the new cycling framework approved at Council last week.
Yes.
The city had previously had some challenges meeting its goals in the cycling master plan. So I'm curious of what makes this recent push different.
Well, certainly, I think all council felt that we were moving too slow on this issue. We do have the 7 new cycling paths, cycling lanes for active transportation open, 12 more opening soon for a total of 19. So we're very delighted that on the progress that we have made. The only complaint I have is I do agree with you. I think we were a little bit slow to act, and many of them were in the downtown area rather than in the more remote areas of the city.
Just a follow-up question, perhaps, for Dr. Lowe.
Certainly.
Thanks, Steve. Go ahead with your question.
Dr. Lowe, if Mississauga's cases continue to be this low and Caledon's as well, but Brampton's remain kind of in double digits, would you advocate with the province to reopen Caledon and Mississauga faster than Brampton?
It's a great question, Steve. I think I would be very challenged to advocate for that, given that I was in Brampton this morning and I was in Mississauga this afternoon. I think we do know that the interconnections between the two cities are significant. And I think there's also the perspective, as I said, around the capacity to test, to trace, to treat, which are all optimal. So the idea being that it actually is probably easier if you open all together as a region and individuals are using their services in their local region rather than potentially bringing the virus to other areas that are having lower incidence. So I think it works certainly in a more rural community, as it did in Windsor and Essex, for example, because I know Kingsville and Leamington. I grew up in London, Ontario, so I know the area pretty well. Kingsville and Leamington are fairly far from Windsor, but just given how integrated we are here in the region of Peel between Brampton and Mississauga and Caledon, I would be challenged, but I could certainly be convinced otherwise if there are other factors pointing to an ability to contain things within the city of Brampton if it were to come to that. So thank you for the question.
Thank you. I'm back.
Mayor Crombie, your next question comes from Jason Miller from the Toronto Star. Jason, please go ahead.
Hello, Madam Mayor. Jason Miller here. I know my colleague Noor addressed some of what I'm about to ask, but just to be a little bit more specific here, Mayor Brown noted that there were 14 charges or so laid in relation to gatherings and so on over the last week, let's say 7 or so days. What are we seeing in Mississauga? He also noted that 2 of those were related to kind of large residential gatherings, which he's cautioning against.
Correct.
How are you tracking over the last say week or so in Mississauga as it relates to that issue, Madam Mayor?
So thank you for the question, and I know that Brampton have had their challenges with respect to large gatherings and house parties. They were, in fact, the first to lay a $100,000 fine for a house party right at the beginning of the, shall we call it, the lockdown. Certainly Mississauga, we are barely issuing any tickets any longer. I'll have to go back and check the numbers. We get the daily updates every day. I looked through them today and didn't see anything of note. So I want to say that our people are following the guidelines and complying with rules. So I'm getting a note. There is zero tickets have been issued. I'm getting hand signals. 0 tickets have been issued. Thank you, Jason.
And just to follow quickly, you noted that Brampton had that record-setting fine. What can you say about Mississauga in terms of fines that have been levied? What seems to be the most significant, if you have that ready?
I don't have the numbers with me at the podium, but I will get them to you, Jason. I believe it was about 350 fines that had been laid throughout all categories, whether non-essential businesses were open or using a closed facility, people gathering of more than 5 individuals. In all categories, we issued only about 350 tickets, and the fine was up to $1,000.
Mayor Crombie, your next question comes from Ashwara Duda from The Pointer. Please go ahead.
Hello, Madam Mayor.
Hello, greetings.
Some people have raised concerns that elective surgeries that have resumed at Mississauga hospitals may lead to beds being full when a second wave does come. What is your response to this?
So I'm going to allow Dr. Lowe to respond to that, but certainly our hospitals were not permitted to move into elective surgeries until there was the proper capacity in the hospitals to allow them to move into that phase. And Dr. Lowe, if you want to continue to respond, that would be terrific. There we go.
Yes. Thank you, Madam Mayor. Thank you for the question. So at this time, all of our indicators in respect of hospital and healthcare capacity meet the provincial thresholds that were identified. This basically means we are tracking at a proportion of beds that would permit for a potential surge. This data is all available on Peel Public Health's weekly epidemiologic summary. You can go to peelregion.ca/coronavirus/case-status. And if you click on the weekly epi summary there, you'll be able to see our most recent summary. The occupancy numbers that we use for determining whether our capacity is adequate include occupancy for any reason, not only for COVID. Thank you for the question.
Thank you.
Okay.
Thank you.
Thank you very much.
Mayor Crombie, your last question comes from Caledon from My Second Home TV. Caledon, please go ahead.
Mayor Crombie, Premier Ford announced that air conditioning will be mandatory at all long-term houses, long-term care houses, and eventually retirement homes. How you will follow up on that, especially when lots or many of these facilities are already new or not that old?
Correct. So we have many long-term facilities here in the city of Mississauga, and the region of Peel, in fact, operates a number of long-term care facilities as well. And I think Dr. Lowe will be the right person to respond to this question. Thank you for it.
Yeah. Thank you, Caledon, for the question. I think we all recognize and understand, obviously, that concerns around heat illness, heat stroke, heat exhaustion are particularly salient when it comes to the senior populations. I think we also have enough of an understanding of COVID-19 right now to understand the nature of important ventilation as well. So I would imagine that as this proceeds in our long-term care homes, those competing sets of factors will be kept in mind to ensure that our seniors are kept safe, not only from COVID, but also from the potential for heat-related illness. And I know that this is being actively looked at by the Ontario Health Central Region's Integrated Response Table, together with the administrators of long-term care homes throughout our region. So thank you very much for the question.
Thank you, Dr. Lowe. My follow-up for Mayor Crombie as well.
Yes, I'm here.
Very well. Do you think we will see Mississauga very soon, another capital for the movie industry here in North America?
Yes, thank you for the question. We have a very vibrant creative industries strategy. We currently have 5 TV and film studios in Mississauga, with another one looking to open very, very soon. So very exciting times in Mississauga. We have a very thriving creative industries sector that's really a big asset to and economic driver for our economy.
Mayor Crombie, that's all the questions for today.
Thank you very much.
This concludes today's press conference. On behalf of the mayor, I want to thank everyone for participating. Our team will be sharing a link to the video of today's press conference with you shortly. Have a great day. Stay well.
Thanks very much. Thank you, everyone.